I can go ahead and share my screen. Does that sound okay?
Yes, thank you.
I will do that. Does that look okay? Right. Thank you for having me here today. I'm very pleased to join you and hope I can answer some of your questions about ACGME accreditation. I'm going to talk a little bit about ACGME overall and then really focus on program accreditation and how your programs are evaluated in the accreditation system. So I'm going to start with the mission of ACGME, which is to improve healthcare and population health by assessing and enhancing the quality of resident and fellow physicians' education through advancements in accreditation and education. So our primary responsibility is assuring the public that the training that the physicians receive in our programs substantially meets certain standards that are developed by volunteers on our review committees and our board, and that those residents are systematically assessed to assure at the end of their training their ability to practice without supervision. Just to give you an idea of the scope of graduate medical education in the United States, there's almost 12,600 programs now, both residency and fellowship programs. If you count all the core specialties and then the subspecialties and some subspecialties, there are 182 specialties and subspecialties for which we have requirements at ACGME. There are 865 sponsoring institutions, and these range from about a third of them being similar to your institution, more traditional academic health centers with large numbers of programs. About a third at the other end are very small institutions in terms of programs with 1 to 3 programs. So this might be a public health department in a community that has a preventive medicine program, or a medical examiner's office with a forensic pathology program. Overall, there are a large number of residents and fellows in the United States, over 155,000. So since this is 1 out of 7 clinically active physicians in the country, they make a significant contribution to healthcare, medical education, and research in the United States. And I think this has become very evident with the COVID pandemic and the role of residents on the front lines of care. So let me drill down a little bit to program accreditation and talk about how the work gets done. There are 29 review committees and 1 recognition committee, and I'll address recognition in a moment. Of those 29 review committees, 26 are focused on an individual specialty and all of its subspecialties. So for example, Dr. Edje is on the Family Medicine Review Committee, which would review all the core family medicine programs, which is quite a large number, and then any fellowships in family medicine, such as hospice palliative care, geriatrics, and sports medicine. We also have, in addition to the specialty review committees, a transitional year review committee, which is multi-specialty, involving physicians as peer reviewers who are on the specialties represented in requirements for the transitional year. As you probably know, over the past 5 years, we have integrated with the programs previously accredited by the American Osteopathic Association into a single accreditation system. So the programs that previously were AOA accredited have now been accredited by ACGME. And as a result of that, we have an osteopathic neuromuscular medicine Medicine Review Committee, which previously had not been an ACGME, but had been an AOA committee. We have one institutional review committee, which reviews all the sponsoring institutions. And then along with the single accreditation system, we developed a recognition pathway and have one recognition committee, osteopathic principles. So we have over 200 programs with osteopathic recognition, and they can be from any specialty and just need to apply and meet the substantially meet the requirements for osteopathic recognition. So all of this happens on the left side with all of our review committees that I've mentioned. And then the chairs of those review committees sit on our council of review committee chairs, and the chair of that council sits on our board of directors. Again, our board of directors are volunteers who are nominated by several organizations, and they are the ones who delegate the authority to the review committees for accrediting the programs in the specialty. So who serves on these committees to peer review your programs? The majority of the members of the committees are physicians in that specialty. They have 6-year terms, and they are nominated by several organizations. Generally, the ABMS member board for that specialty, the AMA and the AOA, if the AOA previously had that specialty in its accredited programs, and then the specialty society or college that is the primary professional organization for physicians in that specialty. In addition to the peer the nominated physicians, there's a resident on every committee who has a 2-year term, so they need to start at least when they're in residency or fellowship, although they can rotate to post-residency in the 2nd year of their term. And then every committee has a public non-physician member who really is the voice of the public at the review committee table. So let me talk a little bit about the processes that we use for accrediting programs, most of which you are familiar with. And I'm going to be focusing on the next accreditation system, which began about 8 years ago for some of the specialties. Others followed the following year. So really talk about the components that are integral to the next accreditation system. In going to the next accreditation system, where every program is reviewed every year, we moved from the previous system where programs could go as long as 5 years without being reviewed by the review committee, but would have a site visit at least every 5 years. Going to an annual review, we've been able to, for those programs who remain in continued accreditation without any concerns, been able to expand that to 10 years between site visits. And I think, as most of you know, the 10-year site visits have actually been deferred during the pandemic because of the challenges with reestablishing site visits. And I'll talk a little bit about that in a minute. Tied to the 10-year site visit previously was a self-study that the program would do 18 to 24 months prior to the 10-year site visit, and then at the site visit have that reviewed along with their progress in terms of their goals as a result of that self-study. Again, those have been postponed or deferred during the pandemic, and I'll talk a little bit more about plans for that. In addition, programs can receive site visits that might be done even if a program's in continued accreditation to affirm data that has been collected by the review committee. And then I'll talk in more detail about the annual data that each review committee looks at for each program in terms of making the accreditation decision each year. And again, most of that you are familiar with. We do require that each program does a self-evaluation, our annual program evaluation, and that actually is reported to the sponsoring institution, not to the ACGME, other than acknowledging that it has happened. And then we have a parallel system in the clinical learning environment review that has been going on in the next accreditation system. And this is, as you well know, where a clear site visit team would visit the major clinical site for each sponsoring institution about every 2 years. Again, these were suspended for a period of time due to the pandemic, but have resumed on a pilot basis, really focusing on how institutions have been coping with the pandemic. And I won't address that, but there's additional information at the CLEAR website so that you can understand what they're doing at this point in time. So let me talk a little bit about the data that is used by the review committees in making their accreditation decisions each year. You're very familiar with surveys of residents, fellows, and faculty. These were modified 2 years ago, aligned with the new common program requirements, and prior to this year had been delivered to residents, fellows, and faculty in 3 windows based on specialty. Due to the pandemic and kind of fortuitously, we this year had made a decision to expand the time to complete, realizing that institutions were at different places in terms of dealing with surges from the pandemic. And we opened it for all specialties at the same time. And we've just received the data on the surveys for this year, and you should have received the reports for your program, but we actually had the highest response rate ever. More programs than ever achieved the minimum of 70% completion rate for both residents, fellows, and faculty. And if you look across residents, fellows, and faculty on an individual basis, we had a very high response. So we'll likely use this process going forward. We collect information on clinical experience, and for procedure-based specialties, many of them, this is in the form of case logs that are entered either by residents or by the staff of the program. For others that are not procedure-based, a lot of the clinical experience is gathered in the subspecialty questionnaire. We receive data from both the ABMS and AOA boards on the pass rate information for each program. A part of the data that you enter for us is a roster of faculty and residents or fellows, and in those data, included in those data, are scholarly activity, which allows the RC to assess that for each program. We also look at the attrition, the changes in resident complement or faculty complement from year to year, and whether there are any spikes, for example, in residents not successfully completing the program. We look to make sure all the information that is required from the program is available. We give you an opportunity to, in narrative form, let us know the major changes that have happened in your program, and we request you to respond on each citation you might have going into the annual update to tell us about your progress in addressing that citation. Because of the pandemic, there's been many challenges, we know, for all of us at all levels, and certainly in gaps in some of the data that we generally collect about programs. Certainly some of the boards, especially as the pandemic started last year, were unable to deliver either oral or computer-based exams because of the lack of availability of computer centers. So there may have been a gap for some specialties in board data last year, but most of them have been able to continue to provide those data as they come back to more normal function for the boards. Also, last year, when the pandemic hit, a lot of residents, fellows, and faculty had already submitted and had accepted scholarly activity, but those meetings may have changed and some of them did not take place, but we still counted that towards the scholarly activity. And we also prompted you last summer to, in your major changes, address how your program was affected by COVID, so the review committee could understand the data for each program in that context. We also added some questions about COVID to the annual update last year, looking at the impact on the education program in terms of clinical experience, structured didactics, and the use of telemedicine. And then we had a separate questionnaire that was not used for accreditation or not linked to the program, and that was the impact on the health of the faculty and residents. We asked about quarantines, hospitalizations, and deaths of faculty and residents. And actually, we collected that information to be able to share it with the community, and that was published in the February issue of the Journal of Graduate Medical Education. So if you're interested in those data, which were from March through June of last year, you can look at that reference to collect those data. We have just gone through a process in terms of the annual update that you'll be filling out this summer. We have been able to reduce again the number of questions there by looking at questions that weren't frequently used for programs and continued accreditation. They will still be asked of applicants where a lot more detailed information is collected. We will continue to ask the COVID questions, but we've updated those again to make the survey a little bit briefer and still get the information about the impact on your individual program. We will be holding a webinar on the end of this month for all program directors and coordinators, similar to what we did last year on what will be asked in the annual update, but that will be recorded and also distributed at our learning platform, Learn at ACGME, so anybody can access it at any time in preparation for the annual update next summer. Let me talk a little bit about site visits and the accommodations that have been made because of the pandemic. When the pandemic began a year ago in March, we did suspend site visits. As you probably know from meeting our site visit staff, who are wonderful professionals, many of them are educators and physicians doing it as a second career, so ended up in the older age group that was even at higher risk for COVID. So we didn't feel comfortable with them being out in the field and knew that people were very busy and accommodating for COVID and would have a hard time managing a site visit. So during that period of time, they were suspended. We had a site visit team that worked with our executive directors and developed a fairly rigid protocol and research design to resume site visits remotely. We were able to resume on a pilot basis in June and July, largely looking at new applicants, but some continuing accreditation programs. And then based on an iterative method, we were able to refine those and look at the evaluation by the program director and DIO who received the site visit, the site visitors, and the reviewers who receive the data. So we've continued to collect data and feel very comfortable about the reliability and validity of these site visits. We now, knowing that travel is just around the corner, are developing protocols to decide. We will certainly continue some site visits in a remote manner, but develop the criteria with which we might want to do in-person site visits, and then do some randomly assigned both remote and in-person again to investigate the reliability and validity of each mode of site visit. I mentioned the self-studies were suspended and have been suspended, the scheduling of any new self-studies during the pandemic, along with the 10-year site visits. Some programs may have received 10-year site visits if they had a review committee requested site visit and the timing was right for the 10-year site visit. It could all be done at one time. So not all of them have been deferred. So we have a group that's working on the self-studies and what the plan will be going forward given this hiatus. And we actually have had over 2,000 programs that have completed self-studies, but not yet had a 10-year site visit. So we hope to be able to have a group of site visitors who will review those and at the program's discretion provide feedback, since we don't have a scheduled date for those 10-year site visits. And then over the next 18 months, we'll develop the protocol going forward. So don't anticipate scheduling new self-studies until the middle of 2022. And the same way with the 10-year accreditation site visits, we have a team that's looking at, given that we have deferred so many, how those will go forward, and we will be keeping you informed as plans for that are developed. So let me return to the annual review, kind of the timeline for the academic year, which you're very familiar with. We do have the annual update in the summer. It generally opens after the 4th of July, initially for a non-case log based specialty programs, and subsequently through September for case log programs. Then those data are analyzed by our data analytics group, and they create a dashboard for each program that goes to the executive director, who's kind of the CEO of the review committee and their teams. And they just look for outliers in terms of information from the sources that I've already mentioned. If there are any concerns, then those programs will be reviewed to a member of the review committee at their winter meeting, which is generally between December and February, with the bulk in January. So the majority of the programs are reviewed at that meeting, and the letters of notification go out shortly thereafter. There's a few programs that are carried over to the spring meeting, largely in April, and that's for those that need additional information, sometimes which would require a site visit. So the review committees look at the annual outcome data every fall, initially by the executive director and their team. They identify any programs that might be at risk, decide any additional information that might be needed from a site visit, for example, and then we'll review those programs at the review committee meeting in the winter, looking for substantial compliance with the requirements. So just to give you an idea of the process, if a program is on warning or probation, which we consider adverse actions, then that program will automatically go for further review, and the new data that has been collected will be looked at to see how it satisfies the citations that resulted in the warning warning, or probation. Programs that are on continued accreditation but have citations that haven't yet been resolved, as I mentioned, will have addressed those citations in terms of their progress in resolving those. So those will be reviewed also by the ED team and a member of the committee to decide whether the citations can be resolved. If the annual data analysis, which is done in the fall, reveals any issues such as residents not completing the program or significant declines on a survey of residents or faculty, then those may go for further information from a site visit and will be reviewed by a reviewer. Programs that have none of those, that are in none of those categories, then would receive continued accreditation for another year. And the vast majority of those are handled by a consent agenda at the review committee meeting. So what is the outcome of all of that work, and what are the chances that your program will have an adverse action? They're really very low, and that was the reason for the next accreditation system, was realizing that the vast majority of programs continue to deliver high quality graduate medical education to the residents and the fellows. So almost 98% of programs will be in that continued accreditation window where they have received a very positive letter. They may have an occasional citation, but generally are doing well. About 1.5% of programs will have continued accreditation, but a warning, which, as you know, means pay close attention to these citations because they are considered to be serious, and we will look for progress in addressing those at your next evaluation. If those citations can't be improved upon, then a program may go on probation, again, a very small number. And if they still are unable to correct the deficiencies, there will be consideration of withdrawal, which is a very small number. In addition to programs on continued accreditation and the other categories I've mentioned, a significant subset of programs either are new applications or have been on initial accreditation where they may be site visited after 2 years, and residents or fellows are in the program, so they will receive decisions about going to continued accreditation. So where can you go for information? How do you keep updated in between times that I come and talk to you about what's going on at the ACGME? Well, most of you, if you're a program director or program coordinator in our database, you will receive our weekly e-communication. I would encourage you not to delete it without opening it, although I know that does occur, but you can glance down and see if there's any new material there that might be relevant to your program. I've mentioned Learn at ACGME, which is our distance learning component of our website. There are already lots of materials there for administrators of programs, program coordinators, program directors, and other leadership, faculty, and residents. So please take advantage of that. And again, by the end of this month, we'll have posted there more detailed information about the questions in the annual update for starting this summer. We do have an annual education conference. It was totally virtual this year, and I hope many of you could attend since you didn't have to pay to fly somewhere and stay in a hotel. We actually set a record for attendance at the conference, and for those of you who had the premium conference attendance, you can continue to access that information at our website. We do have a program director's guide, and I'll show you on one of our web pages syllabus, how you can get to that. It has each of the common program requirements and a detailed discussion about how to substantially adhere to those program requirements. And then we have a wonderful staff for each specialty in our executive director's offices. They are waiting for you to contact them with any questions because they'd rather you ask up front than have data that needs further clarification or reviews at the review committee. ADS also is available to answer any of your questions about entering or accessing data in our system. The site visitors are in the field activities department. You can also ask questions to them about anything related to site visits. And as I mentioned, the review committee staff is happy to answer your questions about program requirements, applications, your letters of notifications, how you can do complement requests, and anything related to the case log system. To access, excuse me, the executive director team for your specialty, if you go to our homepage and on the top flag, go to specialties, they'll all be listed there. I went to A, anesthesiology, and all of them have a common flag on the right of the page. You can drill down into the specific program requirements and FAQs for your specialty. The program director's guide that I mentioned is under documents and resources, so is available just by clicking through there. And then if you go down further on that right flag, you can get the emails for everybody who is on the team for your specialty and email any of them with your questions, and they'll get back to you very quickly. So what is the future of program accreditation? Again, we will continue our assurance to the public that graduate medical education in this country does meet a current standard that has been determined by each of the specialties, and that all of the physicians who are training in those programs have demonstrated that they're able to meet the competencies necessary to practice that specialty upon completion of the program. And then we also hope that some of the tools and information that you gather and that we return to you, such as the resident and faculty surveys, are helpful to you in terms of the improvement work that you do within your own program, so that we can all get better in terms of producing the best physicians possible to care for the public. So I'd be happy to answer any questions. I'll get out of the share so we can see each other. I don't know if you generally do chat or oral questions, but whatever would be feasible and we have time for, I'm happy to do.
Thank you so much, Dr. Kirk. That was a wonderful presentation, and we're really grateful for all that information. I'm going to jump in with a question, and maybe Dr. Edje might be able to answer part of it too. I've only been in this program for under a year, but I've been around GME for quite a while, and I was blessed with a PRN site visit in January. And I just want to first say that how amazing the site visitors were and how smooth and transparent and everything. The entire process was just perfect, and we were very lucky to come out of it very, very well. So kudos to everybody there for doing the virtual site visits, because we had a great experience. My question though is, and again, it's kind of, I've been around GME for about 20 years, and definitely the culture has changed with the residents and fellows, in the sense that you used to be able to just tell them you have to do this because I said so, and now they want a reason why. Why do I have to do what you're telling me? And I don't know that they fully understand. How do we best explain to them, you know, the ACGME has these guidelines for a reason, and these are what they are, and this is why we're asking you to do this. And I think we just need a better education format for them on what the ACGME is and what it does, and any suggestions on how we can do that.
Yeah, and that's a good question, Michael, and we hear that from our residents who are on our review committees. Once they see the other side, they're like, aha, that's why we have to do that. So I agree, it is a challenge, and I think probably similar to what you're saying is about all you can do in terms of saying that, you know, other people in your specialty, whatever specialty it is, have set these rules in terms of assuring the public that the education you receive is going to help you to be able to practice excellent care in this specialty, and that's why you have to jump through the hoops while you're here to go through that, because I know it is a challenge as they do that. Not everything can you blame on ACGME, as
No,
you know.
I know.
Many of those modules are not our fault, but you can throw that in there.
Perfect, thank you. Anybody else, please, questions if you have them, either through the chat or show yourself. Very unusual for coordinators to be quiet.
Dr. Kirk, I just wanted to say thank you so much for answering a chat when we were on probably a 9-hour Zoom call and you were a guest. It's just an honor that you took time out of your busy life to come to Cincinnati via Zoom for us. So thank you so much.
Well, thank you for having me. As you can tell, it's a topic I enjoy talking about, and I'm very interested to make sure that everybody has all the information that they need to make their jobs a little bit easier, I hope.
Well, we're hoping in another year's time, maybe we can do this in person with a full day of events. We're really trying to get our coordinators all the professional development and information they need. So hopefully, well, maybe in a year's time, we can invite you to Cincinnati.
And I think, as you all know, and again, at our website and through our e-communications, we also have programming courses for coordinators, for program directors, for faculty. Some of our assessment courses that Eric Hombo and his staff in Milestones do are really, really excellent and designed to be a teach the teacher. So somebody from your faculty or your coordinators could go and then come back and share with others at the institution. So as you have time or are interested in those, I would highly recommend them.
Thank you. Anybody else have any questions for Dr. Kirk? So quiet, my goodness. I guess they have all the answers they need. That's good. All right, well, I think then we'll jump right in with Dr. Edje. Dr. Kirk, are you able to hang around a little bit? Or?
I'm gonna need to get off, but again, thank you all for letting me join you, and I look forward to seeing you all in person someday. Thanks.
Perfect, thank you so much. All right, Dr. Edje, the floor is yours.
Thank you. I'm going to go ahead and turn off my camera and then share my screen. I want to make sure my bandwidth is okay for you. Okay, so we're going to be talking about the site visit, the what, why, who, where, when, and hows of the process. And just to give you a bit of information about a couple of hats that you may not already know that I have. I was a residency program director for 7 years in family medicine and DIO prior to being here as well. And then additionally, I'm on ACGME as a reviewer for family medicine. So what I want to do today is to kind of bring some of the lens to the site visit itself, but then also what happens after the site visit to give you sort of an insight scoop on that as well. And I've also started a new program. So that means that going through the process of a site visit for a new program is a little bit different, but I'll go ahead and touch briefly on that. So our objectives today are really to be familiar with what can prompt a site visit, it will be as inclusive a list as we have so far, to be able to articulate what is required for pre-site visit preparation, to be familiar with what occurs on the day of the site visit, to know the elements which contribute to the final recommendation from the review committee, and then to be able to recognize good versus bad citations. We'll just do a tiny bit at the end. So one thing I just do want to point out, and I think this is something that is not always remembered, the importance of the site visit is that we have an incredibly serious responsibility to each and every learner who matches at our institution. I mean, this is to fulfill our obligations. Match is hard. They've made serious selections. They've moved across country to ensure that they've got the best education. And this is an opportunity for us to fulfill that. It's also an opportunity for us to nurture their dreams of becoming the physicians that they want to be. They're relying on us to educate them rigorously in an environment that's psychologically safe for learning, and that they're not harmed in the process, and they're not harming the patients in the process as well. So it's our job to make sure that they leave more of who they are before they get to us than when they leave. So again, we should not be taking anything away from them, their personality, who they are, anything like that. Really is to expound them and to have them grow. The site visits really are the checks and balances of those promises. And so accreditation is the scaffold upon which all of their dreams stand. And we are our learners' advocates. We are responsible for accurate assessments of their advancement from year to year so that they can really launch into a healthy career. So what can prompt a site visit? A lot of times it's just that routine check. It's a 10-year. It's just here because it's here. This is one of the parts of NAS. And if you've been cycling along and filling out your web ads the way you should every single year and having no citations or very few, then you should not really have any problem. Certainly, if there's going to be a new program, let's say possibly a new fellowship off of an existing program or a new program, that will prompt a site visit. What can prompt it as well is concern. So you could have concern from web ads. Let's say something on web ads, maybe it's a resident survey that has prompted some concern, that can initiate a site visit as well. For example, in your resident survey, if all of the 6 areas are going down, trending downward over 3 different bullet points, then you definitely are probably going to have somebody pop in and say hi and see what's going on. It can also be prompted by a complaint from a resident, from a faculty member, from a patient. And in this situation, it's called an egregious complaint. And the family medicine had their review, the committee had their review last Thursday and Friday. And one of the ones that I had was a review that was an egregious complaint. Some of those end up being nothing, but if they have any concern, they may prompt a site visit to just double check and see whether there's anything that's really substantive in the complaint. One other thing that can prompt it as well is a lot of construction. Meaning you are trying to build your program and you're asking for complement increases. And it does not typically happen in that arena that you'd get a site visit. But if you're going for 14 or 15, you're doubling your program, something like that, which you can do in rare circumstances, it may prompt a site visit as well. In general, complement increases are onesie twosies. What usually happens is I'll get an email in my box with all of the information on the web ads already printed up for that particular program. I will get the copy of the rationale for the increase in complement. And as a reviewer, I go ahead, review all that information, and it's a one-person decision typically, unless there's some significant concern. Again, I do that for family medicine. I don't do any reviews for family medicine in our state for conflict of interest reasons. For the pre-site visit, I actually made this a nighttime slide just to remind me to tell you, do not do prep the night before. This is an extremely important piece. Again, you should be doing continuous checks on your web ads as you go through. Definitely utilize the GME office, and we'll talk about this a little bit more. All the documents do need to be reviewed by us before they leave the institution. That's actually a requirement of the DIO and the program director. The program director has to go ahead and send that information to us because the ACGME doesn't want information that is not specific to their request coming to them. You may also be asked to provide additional documentation prior to your visit. So, again, you want to make sure you've given yourself enough time. In my program, what we would always do is as soon as we found out what the site visit date was, we set the date, the exact date, exact time, the week before, for us to have all our documents ready to go as if we were going to have a site visit a week before. I mean, it was that strict. We were just like, so we had a week to just, relax a little bit, make sure if there were any hiccups, we've taken care of them. Consider a Google document with assignments. I've used these significantly for things like updating scholarship and things like that. It's more important when you have a new program, I think, to kind of keep track of who has responded. There's also a little bit of a peer review process there, when you realize that, all 6 of your co-residents have updated their document. It just makes it easier for a program coordinator then to just go ahead and transfer all that information in or update as you go. Have, again, everything ready the week before if you can. I mean, if you make that your goal, usually you're pretty safe. Confirm your platform if it's virtual. And we'll talk about this a little bit down the line. Confirm easy access for the site visitor to all documents as well. They may ask for documents to help them with their process before they leave that day. So they've probably done some pre-site visit work. They've looked at documents. They may ask for additional documents before they get there. They may ask for documents while they're in the visit. So a question or a concern may be prompted by somebody they've spoken to during the course of the site visit day. You want to make sure that you are able to kind of gather as much as you can before they leave, because what they want to do is to try and close this job and move to the next site visit and do it in a very succinct format. Schedule, that's something that's extremely important, and we'll talk about that in just a little bit. So the when, I will usually get notification. The program director will usually get notification as well as to when the site visit will be. But we do have an opportunity to kind of narrow that down. And of course, that means that we've got what we call blackout dates. And those will be dates that are sent out where you just try and avoid, let's say the program director is out and the DIO is out, well, they're not going to do a site visit. If it's a new program, if the CEO's out and the DIO's out, they won't do a site visit. And so it just narrows it down. Typically, if you have 1 week where somebody's out, then they will not pick that week at all. So you have to kind of be very careful. Occasionally, we've had what we call at-risk weeks where I'm going to be out, but we've already got other dates that are out that we've already put out too many dates, basically. The day of the site visit, we'll look at that. We'll confirm, you definitely need to confirm that all parties are going to be present. And most site visitors will want not just this section has residents, they will want name, they will want your cell phone number for the resident and email and so forth on that agenda. An absence can reflect disorganization, and that actually is tied to a citation. It's in family medicine, it's called the Martha, which would be, quote, sloppy program director, which means the program director has not paid attention to detail. And so we really don't want that to absence to actually trigger a citation. And you want to be able to be ahead of schedule, be prepared to be ahead of schedule. Depending upon the site visitor, you may find that you may have a window of maybe a half an hour to 45 minutes on either side of a set interview time that individuals need to be available to step in. We had a site visit probably, let's see, January or so. And I ended up being called in an hour and a half earlier than expected. So, drop everything and kind of be present was what I ended up having to do. So, set the expectation that people have to be somewhat flexible. So the how, site visitors, if it's in person, you as a program coordinator may end up needing to confirm logistics of travel, room, and board, because a site visitor may or may not have been to our city before and have to find a place to sleep that night before. You may have to pick them up. I have picked up a program, a site visitor in the rain who got lost on the way in the morning. And think about the first case in the OR. If that case is late and you've lined up 20 odd people who would be having very specific visits with the site visitor, now you've got a domino effect. So you want to be early, better err on the side of caution, and make sure that they know what they need. Again, be ready to meet them early. If it's virtual, absolutely pay attention to which platform. We have had situations where Teams links were sent to participants when it was a Zoom meeting that was to be occurring. So be very careful. That can really sort of slow down your day. Test your links as well. Make sure that before you send something out that it's actually not got, a missing digit on the end or something like that when you send it out. So who, as far as site visitors? The site visitor is usually regionally assigned. In fact, I've had the same site visitor for the program I started in Northern Ohio and for one of our programs here in Cincinnati. Totally different specialty than both of the programs that were being visited. They usually, as Dr. Kirk said, do have background that is very good in education in general. So medical education, they've been in it for a long time, usually retired, or it's a side gig, a very serious side gig where they have a lot of time to be able to go ahead and travel. A lot of them will cluster their visits. So 5 or 6 visits within the span of a week. So, again, they're trying to go ahead and set things up. And if you have to change dates, that's a very big inconvenience. So really, when you've got a date, stick with the date. They will also, again, as I said, request specific names of participants. Do not put a name in a register or in a schedule if you don't think they're going to make it, or they've said, I might not be available. You want to be as solid with that individual as you possibly can. So this is Lee Tang. She's the one who sort of everywhere I go for a site visit, there she is. She's excellent, but she, again, I was family medicine when she came by, and she is not a family doc. She's in the surgical specialties. So who from our side of the aisle? Definitely the program director, usually going to be at the beginning of the visit and also at the end. So make sure you have flexibility. I would book out the entire day. Make sure your program director is booked out. The DIO as well, typically going to have a visit, usually earlier in the day, sometimes in the afternoon, but that's going to be a visit mainly to make sure that there's substantive support for the program in the strategy of the health system, and that there's also financial support. We've had some really egregious things that happened with Henneman closure back in 2019 when there were over 600 learners that were displaced. And that is a complete breach of the obligation that they had to these folks who tried to match. Chief Academic Officer for CODA and CPME. Those two are accrediting bodies, of course, outside of ACGME. That's for dentistry and for podiatry. Residents and fellows, usually a select crew, and being excused from your rotation unless you're post-call, and it's an absolute, every single resident fellow should be there. Key faculty, absolutely, within the program, and sometimes they'll request folks outside the program to be present. Some site directors or site reviewers do not interview the program coordinator, but a lot of them do, and usually for logistics, and it just helps them to get the job done. And you guys are a critically important part of
why'd you put it in parentheses?
I put it in parentheses because you guys get an entire screen yourself, and possibly the chair. So these are Commission on Dental Accreditation and Council on Podiatric Accreditation. So as of the site visit here, this is just a sample program. And actually our most recent one was vascular, so that's why I pulled it up. Lisa did a phenomenal job. This is exactly what your schedule should look like. You should have everything on there, their entire title, their cell phone on there. That's why those have been redacted, and also their email. Additionally, the site visitor will have a mini lunch, but it's almost always working. So make sure that they can get their lunch in there. And for those, I'm just going to go back one. Typically the virtuals, which this was, is actually usually ending at around 2, 3 o'clock. Again, it may be earlier than that, depending upon how long it takes with each of the spaces. We have had situations where they've flipped people as well. So, one person wasn't there, so it sort of catapulted everything forward, or they were going to be late because they were still in the OR, so they just flipped places. So being flexible is really important. So where It could be anywhere. Almost always, there are going to be two components to this. It's going to be a conference room where this individual just sets up shop and works through lunch in that space as well, meets everybody in that room, and then they may or may not do a tour. In these virtual situations, they've been doing virtual tours. I know with our new program that we'd had, we actually had the architect come in, and we also did have a virtual tour for that that site visitor as well. The site visitor will request, and they'll be particularly careful about telling you what they need. And again, may not want interruptions for lunch, and they may do a tour. They're trying to get in and get out, but get the most information. So pre-site visit correspondence. This is just an example of what they may ask. So they will say, we know you have certain existing citations. We need you to make sure that you are up to date in web ads on responding to those. We may have had some concern about whether there's good institutional support for you. So, please clarify that in this section. They also may want to clarify anything they felt that was not quite appropriate. For example, was your block diagram, did it have all the annotations at the bottom or something of that nature? Additionally, they'll also send out a piece of paper or a form for the residents and also for the faculty. And it will have a list of 5 strengths and 5 weaknesses, and somebody's responsible for going ahead and filling that out. That information is not to be shown to or discussed with the program director, and it's meant to be submitted directly to the site visitor. The site visitor will attach the form to this announcement of site visit. And again, tell you what platform they are looking for. As far as web ads prep, make sure you have a partner. That's what we're here for. Amy is our accreditation expert in our GME office space. So have a partner and help us, to help you. So let us know. And certainly if there are questions that you have, you can get a hold of us. Biggest issues with web ads: board certification, check for lapses. You could have been up to date yesterday and all of a sudden it's just lapsed. So that's a pretty common problem for folks. Also with respect to board certification, there are actually certain things that have duplicate spaces in your web ads. If you have an error, and there's conflict information that you've submitted, let's say Dr. X is board certified and you've written board certification on one page in web ads and omitted that by mistake in another section, then that will be a conflict and it'll look like he hasn't lapsed. One thing I would recommend is that you go ahead and print out your entire summary at the end, because sometimes seeing it on paper can show you gaps that you have that you may not see in the electronic space. Definitely confirm that numbers are accurate, because we sit down and we do add up, clinic numbers. For example, in family medicine, you have to have 1,650 outpatient visits that you've seen in clinic that are continuity. And, if you have situations where the number of people that are seen in the clinic is way off from the number that you're adding up with each resident, then that can be a problem. So just be sure they're accurate. We do check things like that. Scholarly reports for the appropriate years. I think obviously you're putting in what scholarship is, but this is not, a paper that was published 3 years ago. They want it from, 2020 to 21, that kind of thing. Major changes section really is a picture of your program, and it really is a chance to articulate, it's a chance to give the personality of your program and show that in that space. It's a chance to, list support, list great things that you've been doing, and it really gives for radiology, giving some clinical picture, instead of just sending an individual for a test. This helps them to make a diagnosis. Responding to all citations, absolutely need to do that, and they shouldn't just be yes, no's, because then you'll get a program director citation, the 2G4A, which is now the 2A4A 8. Beware of the start date of new requirements. So whenever new requirements are coming out, let's say you go ahead and you've submitted your web ads and you have a site visit that's coming up. In between that time, if there are new things that have come up as far as criteria, then you want to be very careful that you're not submitting information based on old criteria. And again, always print your summary as a double check before you consider it's final. A snapshot of a site visit report. Program demographics. Oh, I'll actually pull up a redacted copy so you can see this, but they have program demographics in there. So, you know, how long has the program been there? Background about the sponsoring institution. For example, are there other residencies here? Have they been on probation? Things like that are all included to help them give a picture of the environment. Corrections to WAB ads will be listed in there. Any updates to site visit materials. So if there was a request in the pre-site visit timeframe, they will make sure that anything you submitted by the end of the day on the site visit or anything before the site visit that was additional gets into their report. They will check by check every single requirement. They'll go down the list and make comments on each and every one, and we'll look at that. And then they do give site visit feedback to the program. Some of that is narrative, and it's just a verbal, hey, here are a couple of things I think you can do better, and they won't put that in the actual formal report. Please go ahead and jot down right after your visit. We'll talk briefly about post-visit checkups. The key strengths of the program they'll list. They'll also suggest how a program could improve, and that's all written in the report. They'll give a document list, everything that had been submitted by you. And they're very, very detailed. They pay attention to detail. So this is an example of a site visit report. So again, program number, name, how the process was done, number of positions, whether you filled in your complement. They'll list all of the folks who are folks that they actually interviewed. And then they'll give background about the sponsoring institution, you know, how many have been assigned to which space. They will talk about the size of the hospital, number of births, ER deliveries, again, to paint as much of a clear picture of the institution as they can. They do a lot of homework outside of your program to give this space. They also then go down and make any comments on corrections and give specific dates for that. And then also go ahead and, like I said, requirement by requirement, they go down and they do yes, 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 and they give citation and the actual response that came through. So again, full review against all program requirements. Now there are a bunch of pages in between 3 and 37. So again, every single requirement will be listed. There has been one program, not in our institution, that had 77 citations. I kid you not. They go through and they check everything. So many pages later, they'll give a summary. Again, key strengths, young, enthusiastic, experienced faculty. The only way you can really express those types of things is in the major changes section. Also, when you have the faculty in front of you, you know, making sure that they're, you know, they're just doing a good job showcasing your program. They may actually talk about a couple of things that would be suggestions for improvement. Those may show up in your final report as an AFI or an area for improvement, or they could be just things that are suggested that you might want to consider this. Most other programs in the country are also doing X. And again, I mentioned they have a document list that they'll show, and they'll list whether those were okay. Post-visit, not time to relax just yet. What you want to do is to make sure you kind of sit down and just jot down everything you can remember that they said were improvements or strengths. You know, again, because not everything makes it into the formal report. Shoot us an email and let us know what those things are so that we can kind of keep, we have a document that we try and keep updated on post-site visit items, just so that we can make sure that we can all learn from everyone else's information and just keep on board. Not all comments, again, become citations or AFIs. And again, the GME keeps a list of those visits. So what happens next? So once the site visit report has been completed, which is usually several days after the visit, it's then sent to, it's emailed to the RC. The RC goes ahead and includes the site visit report. You can see right here, site visit report is one of multiple items that go into determining what your final recommendation is. So survey reports for both faculty and residents, letters of notification, any citations that were previous or extended, any reviewer materials, so additional things that may have been requested, the site visit report itself, history of the program. There's also a history summary. So, you know, when did this program start? 1974, has had X number of citations since the beginning. These are the most common ones. This is an ongoing one, you know, 80-hour work week. And these are the things that they've tried to do to improve. There's a reviewer template, which we'll look at in just a second. There are supplemental materials, for example, copies of your evaluation forms that are have objectives and goals and so forth. They will have a history of any complement change requests that you've asked for and why they were you know, granted or denied. There will be an evaluation that you're able to view on the whole thing. And then they do look at board certification as well. And it's they have a separate tab for that because, again, that's a pretty important part that they check for. So what does the review committee do? Family Medicine's review committee is about 18 people from the various areas that Dr. Kirk just mentioned. Right now we're doing them in Zoom, but typically this is 401 North Michigan Street in Chicago. And we pretty much spend 2 days there solid from beginning to end of the day and trying to knock these out. Again, for family medicine, we've got 700 programs. So over the course of the year, the 20 of us have to review all of those and submit. The same thing happens for all of the other specialties. Typically, the times that we meet are 3 times a year. So January, April, and October. And what they do is review programs against common program requirements and specialty requirements, determine the accreditation status for programs, propose new revisions. In fact, we're in the process of doing some new revisions right now. Discuss policy and issues related to the specialty. Is there something going on in the world of, you know, plastic surgery that needs to be incorporated in? Is there any new innovation that needs to be incorporated as standard? Do we, you know, way back in the day, do we start requiring, you know, laparoscopic procedures instead of open because, you know, now nobody knows how to do an open because, you know, they're just so few and far between. Recommended changes to policy, procedures, and requirements to the ACGME Council of Review chairs. So again, funneling up to the chairs if there are problems. There may be problems that are common across all specialties, in which case the chairs get together and they can make sweeping recommendations. So reviewer's template, this is what a reviewer will get in their mailbox with the list of things that go into making a decision, the materials. And if you look at the top, typically each program is reviewed by 2 people on the RC separately. Each of us then gives our independent report, and that gets compiled into a document. Then we meet just before the RC meeting and reconcile. So we go ahead and make sure that we all got the same, you know, the 2 of us got the same citations and suggestions. Should this be a citation? So should this be an AFI? Just to give an example, the 1650 requirement for family medicine with telehealth, we had an issue because they're meant to be face-to-face. And a lot of programs were like, okay, we shut down March and April. So we didn't have in-person visits. That affected us. We switched to telehealth. Should we include the telehealth visits in the 1650, although they weren't actually face-to-face? So that may change from a citation previously now to an AFI. So again, down at the bottom here, please include the detailed sources for why a program was non-compliant. So as they're forming their report, you've got an annotation for where the PR is, you know, what the program requirement was, the rationale for why you gave the citation, so that the program can actually understand what was the reason for the problem. And then they can find out and check the box here, where should they look for this? Was this in ads? Was this in the site visit report? Where did you get this information? At the very bottom, then, a list of areas of improvement. So again, short of even an AFI, just suggestions. And then commendations, absolutely. This program is done beautifully. You know, it had 77 citations. Now it's down to 1. That will get a commendation. And then depending upon what's a new program or not, you'll get a 1-year or 2-year cycle. Almost all new programs will get a 2-year cycle if they're a nice clean slate. If they're really concerned about the fact that, wow, this is sort of a momsy twosie pop shop thing and nobody's really paying attention, then they're going to give you a 1-year cycle or withhold accreditation and give suggestions for reapplying. So looking at this, I'm just bringing this up. This is your common program requirement table of contents. And specifically the program coordinator section You are, and I need to just emphasize this, I've said it before, but just a reminder to you, as you probably already know, but don't hear it enough, that you are a member of the leadership team that is critical to the success of the program. No program can run without you, and that's such an important thing to know. It also means that the things that you are doing, the knowledge that you have, be empowered to go ahead and have a good relationship with your program director to bring issues up of concern. For example, if you find that there's a citation response in WebAS that you're like, geez, Pete, I don't know that that answered the question, then you're not the one who's to write the citation. They're meant to do it. But if there's an issue, please go ahead and feel empowered to ask questions and to offer your expertise. So just briefly before we close, an example of citation responses. I'm going to go ahead and here's one citation, and we're going to just talk about whether this is a good or a bad one as far as response to it. So the citation is a program director citation. Section 2 of the program requirements deals with personnel. So any requirement that comes back with a Roman numeral 2 in front is one of those. This is actually a 2A 4A8 citation as opposed to a 2A 4G. It's a program director issue. So the program director must prepare and submit all information required and requested by the ACGME. Very, very common one. Again, board certifications lapsed, didn't update the faculty roster. Those types of things will get this one. And the rationale is in the second paragraph. Review of the program's ads show that some information provided was inaccurate and incomplete. Most notably, the patient population statistics table, the percentage of ED patients. Additionally, the faculty roster indicated multiple faculty members whose board certification appeared to be out of date. Now, the response from the program is, the St. Elsewhere Hospital data was collected and reviewed with their administrators and site director. The data provided adds up to 100%. The faculty roster was reviewed and updated for faculty numbers. So any brave soul want to say whether this is a good one or a bad one as far as a program response? And why?
Hey, Dr. Edje, it's Mandy Pack.
Hi.
It's a bad one, right?
Okay, why do you think that?
Oh, because I think that, some of the people need to have protected time and things like that.
Mm-hmm. And we're going to go ahead and look at the rationale here. So you were right. They should try again on this response. Let's see. So we have been working on the challenge of service versus education since our ACGME survey results just demonstrated low compliance. We've taken a multi-pronged approach to this very important issue. As alluded to into the citation, it's not denying, it's actually confirming, yes, we acknowledge that there was a problem. This is all we've done to deal with this. 5 of the 6 open clinical positions were filled between this date and this date. There's a lot of specificity in this. It's acknowledgement that there was an issue. There's time that was taken into this, down at the bottom there. The positive effect on morale is evident in the monthly residency meetings. So you're talking about outcomes from the things that you've implemented as well. So that's a good citation right there. It identifies underlying problems for qualified program response. And rather than just describing a change in scheduling, the program, supports improvement by measuring post-intervention outcomes. So again, you're showing that the changes you have made have actually had some effect. So that was a well done one. So our objectives were to be familiar with what can prompt a site visit, be able to articulate what is required for pre-site visit preparation, to be familiar with what occurs on the day of the site visit, to know the elements which contribute to the final recommendation, and to be able to recognize a good versus bad citation. And while I was putting up pictures, I obviously don't have everyone's pictures, but I wanted to say that you really are the glue in the program. You are the fixers, you are the trusted advisors for both program directors and residents in many situations. And I would say the mom and dad thing, because all the residents I've worked with as PD in the past, you've been go-tos for so many things. You're dedicated, you're organized, you're committed. You're the heart and soul of our programs. And we couldn't do our jobs without you. We see you, we understand that, and you're appreciated and so greatly valued. So thank you so much for all you do. And thank you for having me and to take a little bit of your time today. I'm going to stop sharing and I can answer any questions.
Thank you, Dr. Edje. I think I can speak from all of us to say how grateful and lucky we are to have you as our Associate Dean and DIO, because you truly are a huge supporter of everything we do, and we're just so grateful and blessed. So thank you for everything you do for us here at the University of Cincinnati.
Absolutely.
I'm gonna start off with a question again. And it's a little off topic, but you touched on it. How the program core requirements say that we're part of program leadership. How do we battle the fact that, yes, our program directors believe that, but maybe not all department leadership understand that, or understand also that ACGME has requirements about FTE time and things? How do we deal with that?
So a couple of different things, and I think that falls partly into my bucket as well. Number one, I think we've already started with a job description. That is a very, very important start. I know back in June, when we started to have people sort of furloughed here and there, and Friday afternoons were being taken off and Fridays were being taken out, and we sort of went to bat stating, listen, you know, program directors are not secretaries. Program directors are a critical part of everything that happens within a program. And I think just trying to help define the reality of what you do is very important for folks outside the space. So clarifying the JD, when we did that back in June, just kind of try to pull everyone together. They're like, well, we don't want to furlough anybody, but tell us who are your program coordinators. Well, everyone had different different titles, not even job descriptions, different titles. So even just getting a list for them out of their database was very difficult. So I think just getting to a common language, I think, is the first thing. Secondly, the difficulty with the chair piece is the fact that chairs are not acknowledged in the program requirements, but they're integral partners in each of our specialty spaces. And so for that reason, there is a problem with role definition, I think, in certain situations. And it's our job really from the GME standpoint to help clarify that and to help to support each of you in your spaces. One of the things we want to do is to make sure from the FTE standpoint that we're keeping up with the differences within specialties. I know for family medicine, we've changed to 0.4 FTE, that is protected time for program coordinators. In other specialties, it's different. Also, you've got coordinators that may just have one fellow or one resident in a space, mostly one fellow. And in that situation, it's like, well, you're only working for the GME part of your job for 10% of your job or something else, and the rest of it is doing something completely different. And we don't have a lot of control about the difference there. What we can do, though, is number one, become aware of it. So keep us posted if that is happening, and then go ahead and sit down and talk about the totality of what you do in the context of discussions with the chairs. So we are willing to go ahead and do that. If we don't know about it, we will not be able to go ahead and advocate. So let us know if that is an issue. And again, I think the job description will help. That's in process right now.
Great, thank you. We had a couple things in the chat. Kim was asking, how far back do they usually request documents for review for the 10-year site visit?
Oh, they can go back 5 years, especially with things like scholarly activity. That will usually go back that far. They've usually kept a bunch of information from you anyway from your web ads. So if there's any citation that's come up in web ads that's recurrent, that's when you really want to make sure that that's been taken care of, or you've got a really good set of documentation as to what you've been doing to try and mitigate the problem. Extended citations, which is something we see fairly regularly. Again, I'm going to use my family medicine lens, but if family docs don't have privileges to do it, OB at a hospital, and it's just the hospital policy, well, there's a requirement that all family medicine faculty, it's a number 2 requirement, all family medicine faculty have to role model delivery of patients, and so they're not going to be able to do that in that space. That's going to be a continued citation, and it really does end up being the purview of the RC to figure out how they reconcile that.
Thank you. And Tim had a comment that if in reviewing the faculty survey and resident survey, you notice a downward trend, you should address this, and there are major changes to show the RC that you see this and how you are addressing it. So, do you have anything to add?
Absolutely. Yeah, I will say that our accreditation committee is run by Dr. McDonough, and Amy is on that committee and a tremendous support. One of the things that they do is if they see a downward trend, either with the APES or anything else, they see that downward trend in your resident surveys or even faculty surveys, then they may actually trigger a site review. I'm sorry, a special review, just so that we can kind of preemptively manage anything. So if, I think people get a little sensitive sometimes when they're like, okay, we're going to have, a special review. Well, the purpose of that is to preempt you from having a site visit, because there are certain things that will trigger site visit. And if you have multiple programs that are having the same problem, it will trigger an institutional review as well. So we try and call it preventive medicine, right? We're trying to get ahead of it and prevent it from being something that is outside of our institutional space.
Thank you. Anybody else have any other questions? Lots of thank yous in the chat, so thank you.
You're welcome. Thank you.
All right, I think then if no one else has any questions, we'll jump right into our next speaker. Thank you again, Dr. Edje. We really are so grateful for everything. Our next speaker is Tim Burns. Tim Burns graduated from Suffolk University with a degree in government and history. He obtained a law degree from Suffolk University Law School and has worked in GME since 1994. He worked at the Brigham and Women's Internal Medicine Residency Program as a coordinator from 94 to 2016, and then became the program administrator for the ObGyn residency program at the University of Vermont Medical Center. He is a very active at his institution, where he has helped establish an individual and group mentoring for fellow program administrators, and also helped establish a program administrator journal club. He is also involved in the Association of Program Managers in ObGyn, also known as ACGME. He was the Region 1 representative and is currently the ACGME planning chair. He is also a member of the ACGME Coordinator Advisory Group since 2019. He serves on the ACGME Awards Committee. He has given presentations at national meetings. He's originally from Wakefield, Massachusetts, but has moved to St. Ignace de Staybridge in Quebec, where he lives with his husband, 2 dogs, and 1 cat. So we are very lucky and grateful to have Tim here to talk with us. So Tim, the floor is yours.
Good morning, everyone. Again, my name is Tim Burns, and I'm the program administrator at the University of Vermont Medical Center ObGyn residency program. Can everybody hear me? Just want to make sure.
Yes, sir.
Okay, great. So what I'm here to talk to you about is the ACGME Coordinator Advisory Group. I've been a member of this group for a couple of years now. And what is the Coordinator Advisory Group? Well, we were established to advise the ACGME administration concerning things that are happening with coordinators, GME, the learning environment, and accreditation matters. They really recognize that we are a key component to graduate medical education, and they created this group so they could get our opinions and advice on things that are happening in graduate medical education. One source of insight is improving communication, the ACGME process, interactions with the GME community. So the overall goal is to further the ACGME mission. So we as a group we represent everyone. We represent all coordinators. We don't represent just one subspecialty, institution, or organization. They actually really put together a diverse group. They look at the size of the institution, where you're located, what subspecialty you're in, and they want to make sure that they have voices from both residency and fellowship. We meet twice a year. We're meeting this week. We met yesterday and we're meeting today. There are 12 members. It's made up of 3 hospital-based program coordinators, 3 medical program coordinators, 3 surgical program coordinators, and 3 institutional. So it's a 3-year term, and the current term is 2019 to 2022. So how do you become a member? Well, there's a nomination process. When the next term comes up, the ACGME will put out a notice saying that they're looking for members. There's a nomination form. The candidate has to write a letter. They have to disclose that there's no connection, they have no connection to the ACGME, either your family or you. You need to have a current CV. The program director has to write a nomination letter, and you need to find someone else to write an additional letter of support. Just look at this for a moment. I think the special thing is really looking at your current CV. What they're looking for is they're looking for people that have been involved in GME. So this is a really good opportunity to talk about what you can do. And I think this is great, like professional development. So one of the things that I would recommend if you're interested in becoming a member is actually become really active in your GME community, both at your institution, and really look to areas like for me, I'm in obstetrics and gynecology. We have the ACGME. And what I did is I actually really became involved and started off as the associate regional rep for our region. We have 5 regions throughout the country. And then from there, I actually became region rep. I joined the education committee. And now I'm actually in charge of programming for our 2 major conferences. It's also helpful to give presentations. They look at that as like, you know, have you done any presentations at your institution, or even presentations at local, regional, or national meetings. So we are the second group. The first group was started in 2016. And these are the members of the first group. And as you can see, there are actually people that have come from all throughout the country. And this is our current group. And again, we are ending in 2022. So this is what the first group did. They looked at the next accreditation system. They looked at sponsoring institutions 2025. They looked at the website and in e-communications. They looked at the coordinator role in the common program requirements. They looked at wellness initiatives, and they looked at they actually created a coordinator page on the JGME. And what this does is what this page does, it actually lists all of the articles that that program coordinators or administrators or managers, whatever your institution calls you, what you have published. So if you actually have published an article, and it doesn't have to be in the JGME, please let us know so we can make sure that it gets up on this page. And I really would recommend going to the page to actually see all the accomplishments that coordinators have done. They also did advanced coordinator workshops, participated, and they actually were instrumental in the new distance learning programs. And a CAG membership on the ACGME Task Force on Physician Wellbeing, and participated in the symposium for that as well. So what are we doing? So we actually, we talked about, they actually came to us and they wanted to talk to us about creating a new institutional coordinator workshop and what topics and how it should be formatted. There is currently a new residency fellowship coordinator workshop. And what happens is that the institutional coordinators attend this, and which is helpful, but they're very different in a lot of ways. So we actually talked to the institutional coordinators, and we actually helped, and hopefully this is going to be happening in the near future. We actually looked at the resident program concern and complaint process. We actually helped look at the Learn at ACGME distance education platform and gave suggestions on that. We looked at the data system for ADS and the annual update, and we actually gave some suggestions on, what were some of the things that were problematic and things that could be really improved to help both, doing ADS, especially if you look at fellowships, where fellowships have to do most people who have fellowships have maybe more than one, and they have to do multiple ad updates. So it can be a little frustrating using the program. So we were helped make suggestions on how to improve it. And we also talked about with the coordinator forum pre-conference at the ACGME big meeting. We actually review the submissions for that and give recommendations on what should be covered. We also looked at the program director's guide to the common program requirements and gave recommendations on how that could work and what should be covered. And I would really recommend looking at this. It's actually a really good resource for you. Just like for one of the things, it's on the ACGME website, and it's actually very good because you can actually click on the thing and it has hyperlinks. And for individual learning plans, one of the nice things, it actually gives you resources, and it actually gives you a form that you can use or adapt to give to your residents or fellows when they're coming up with their individual and learning plans. And what's nice is that you don't have to recreate the wheel, and you can use that. We actually also talked to the communications department, and we helped look at the e-communication, and we were really talking to them about how it could be improved. One of the things we said is a lot of things stay on the e-communication that is there for many, many months. And I think what people were, when we were reading it, it was very long and a lot of it was very repetitive. So we were asking if they could put in things like new, so that you went, as you were going through it, if it's something new, you could see that. And they actually had made a lot of those improvements. And I think for me, I do read it every week, and I actually have found it really, really well. And again, we are going to be reviewing the session proposals for the upcoming meeting. They were actually started doing a call with the DIOs, which some of the institutional coordinators were on. And we suggested that it would be really good to have a similar thing with coordinators. And we actually did do that. And I actually think it really went well. And hopefully we're going to be doing more of those in the future. And currently what our project is right now is we're working on new coordinator timelines for both residency, fellowship, and institutional coordinators that we are going to be putting up on the website. And we're also working on putting together a handbook that we're working together as a group. Again, it's going to be all encompassing. So it's not going to be, there's going to be few things that are not specific to each subspecialty. But we would hopefully can recommend when those things are, that you really go look at, think about your subspecialty. Also, one of the members on the committee is on the awards committee. I happen to be that person. So what happens is the awards committee meets about 2 or 3 times a year, and we review all the applications for all of the awards. There are 2 awards given out to coordinators. There's one for the institutional, and there's one for the residency and fellowships. And we review these and all the other awards, and those are given out at the ACGME meeting. And I would recommend that in the future, if because I believe the timeline just closed for the application, I really would recommend submitting, because they really are great awards, and it's nice to be recognized for all the accomplishments that we have done. Unfortunately, because of COVID, our meetings have become virtual. Typically, we meet in person. We meet twice a year, as I said earlier. We meet in Chicago at the ACGME offices. But unfortunately, due to COVID, we have been meeting virtually via Zoom. And this was our meeting last September. And again, we are meeting this year, today and tomorrow, yesterday and today, virtually as well. And again, what do we do at our meeting? Well, here's some of the things that we did. So we worked to look at the task force. There was a task force talking about protected time for program directors, associate program directors, and core faculty and program coordinators. And we actually submitted a paper regarding that. And we also submitted comments for the changes due to the common program requirements. So we actually looked at that, and as a group of coordinators, we made some recommendations. And again, they set up a meeting for us, and they had people come to talk to us about what's happening regarding diversity, inclusion, well-being, ADS updates, what's happening with distance learning. Yesterday, we actually had a update on virtual site visits and self-studies. Again, the people from the JGME are going to come talk to us. In September, we talked about the new institutional coordinator workshop. And some of the other things that we're going to be talking about today. Someone from the ACGME is going to come and give us a talk on tips on giving a great presentation. And the education department is going to be coming and talking to us about the annual meeting coming up. And again, these are the projects we're working on. We're working on a handbook for all for new coordinators. And we always are in the process of monitoring the JGME coordinator webpage. And again, if you go onto this page, I would really recommend it, and you notice that you haven't published an article, it's not listed, please let us know so we can make sure that that gets up there. So thank you for taking a few minutes and listening to what we are doing. I'd love to be happy to answer questions. And again, this is our group with one of the last times we met in person, which is too bad. But hopefully, we're hoping that for maybe the September or the next May meeting, that we will actually be able to meet in person again. So I would love to be able to answer any questions if anyone has any.
Thank you, Tim, so much. I really appreciate that. That was great information. And I don't know if a lot of people even know there was an advisory board out there with the ACGME. What is the best way for people to get updates on what you're doing? Where's the best place to go?
So if they actually go to the webpage, the ACGME webpage, we actually there's a whole section on the advisory group. There's actually an email link that you can link, and all of those emails get sent to us as members of the committee.
So if anybody had suggestions or questions, that's what they would do for that.
Yeah. I mean, I think it's really good. I mean, we'd love to hear from people. I mean, I think it's really helpful. And I really would recommend, if people are interested, I think it's a great organization to be part of. And I really would recommend, and it's funny because I think, I applied for the first go round and didn't get in, and I was thinking, well, should I do it or should I do it? And I wasn't going to do it. And then I was like, you know what, I'm just going to apply again. And I was very fortunate to be able to be picked to be on the group. So even if you don't get on the first time you apply, I would still recommend, because they do really look at where you're located, the size of your program, your institution, and they really want diversity. So I really would recommend people applying. It's a great organization to be part of.
Can you expand on the best way to enhance your resume while you're waiting to see if you can get on the committee? I think you did touch on it, but what would be some really specific suggestions about things you could do?
You know, a prime example is, you know, starting at your institution. Like, I think this is a great idea what you guys are doing here, like these kind of things, getting involved in that. We actually have a very strong GME at my institution, which I'm very appreciative. And our manager was the PEDS program administrator for many years. And when she took over the managerial position, you know, she really reached out to each one of us. And we actually have started, which I was involved with starting a mentoring committee. So not only do we do, when we have new program administrators, we hook them up with the seasoned program administrator, and they follow them. We actually have a set of guidelines, what they need to do, how often they need to meet, and things like that. And it really helps with the onboarding for the new program administrators. But then we also do 4 or 5 times a year, we do like group mentoring, where we all get together as a group, and we do like the next one coming up is tips and tricks. And like, so at our AppMog meeting, one of the program administrators actually did a presentation on using Planner and Teams. And I was like amazed, and I've actually become a fan, and actually am using it. So I'm actually going to show people how to use that, and how to, because one of the things I struggle with, I think a lot of people do, is trying to be organized. And the one thing you need to do with this job is really, really focus on organization. And that really has helped me. And then I've reached out to other program administrators to see, do you have any tricks and things like that? So we have like 6 people presenting at that. We've also, every year, we do a session on conflict resolution. And we actually ask everybody to submit issues and problems that they're having. And then we, you know, didact it and try to generalize what it is. But then we present these to the group, and we meet in small groups and say, how would you resolve these issues, and what's the best way? And then we get together as a group. And we usually start off with a little bit of a presentation first before we go into the low part of the workshop. The other thing that we did is started off as a administrative journal club. You know, and everybody does journal clubs, and we were like, why not have one for program administrators? So again, we do them 4 to 5 times a year, and it's run by one of the program administrators. And we usually do like an article on recruitment or well-being or things like that, that really, really focus on what can help improve our programs or the life of a program administrator. And that's been really well. The other thing I would definitely recommend is getting involved in your subspecialty organizations. And it's even just by helping out, like giving a presentation or a talk. That goes really a long way in helping with your resume. Also, I think partly for me, I've been doing this since 1994. It's actually interesting. So I'm, you know, some of my residents that were, when I started, now are in their 50s like me, and I'm like, oh my God, I thought they were so young back then. But yeah, you know, I think really, really getting involved in trying to find things and really improving your resume is very helpful.
I wondered if the University of Vermont would be willing to share some of the things you've been doing, so we don't have to completely recreate the wheel here. Those are some really great.
Happy to help you, yeah, because we don't want people to recreate the wheel. And really, if they're really, really, I have to say the journal club has probably been the best thing. And if you ever want, I can come and help, you know, show you how we do it. It's a really interesting, and it's really good because I think it's also helped I think one of the things when I worked at the Brigham, it's such a large institution. We have a lot of programs. Like just in medicine, we had over, I think it's over 300 residents. We onboarded 70 interns. And then when you add med derm, med anesthesia, med whatever, it came up to like 90. So, I mean, there were 8 people in our office. So, I mean, it was very large, and we didn't report directly to the GME. I was hired by the Department of Medicine. So it was really hard to get to know other coordinators, where at the University of Vermont, we are actually all, about 4 or 5 years ago, they actually took all of us and made us employees of the GME office. So we actually fall under the GME. So we actually have monthly meetings, and this has been a really great way to actually meet my other program administrators and learn from them. And I think Journal Club is a great way to learn from each other, because we all have wealth of knowledge, and it's really great way. And I've actually become really, really close with a lot of my fellow administrators because of that.
That's great. Thank you. Do your monthly meetings, are they run by your GME office, or are they run by the coordinator?
They're actually run by our manager. So we have,
Okay.
we actually just had our meeting yesterday. And just so basically what it's really good, because we talk about things that are, we're talking about right now about PLAs, and, we changed our PLA. So the DIO has to sign all of the PLAs now. So, she brought that up, talked about that, how the new process. The DIO came and actually gave us a talk about the CCC, how a CCC should be run, what information should be collected, and things like that, which was really, really helpful. So we do them once a month. And we also, what was really good is we actually had someone from the library come and talk about how to do a search on PubMed. And it really showed us that if you actually go on through the library, you don't have to worry about paying for any of the articles, because they have a subscription to PubMed and they can get most of them. And if not, you can email them and they'll actually get the articles for you. Do you guys not have a monthly administrator meeting?
We do, that's run by our GME staff, and it's very informative, but we're always looking for new ideas. So, and I think some of them might be on the call, so maybe hopefully they took note. But thank you. Does anybody else have any other questions for Tim? Well, thank you for everything you're doing for the coordinators and on the ACGME, and just and as a whole. I first encountered you at ATMOG this year, and I was very impressed and really grateful that you came virtually to Cincinnati. This was wonderful. Thank you for all you.
Well, I'm actually dying to come to Cincinnati. I've been to Cleveland, and I was actually.
Oh, we're much better than Cleveland.
Well, I was pleasantly surprised. I had never been to Cleveland. I actually never been to Ohio before. So I went about 4 or 5 years ago for New Innovations, and I was really, really impressed how beautiful Ohio is. So my former boss is now actually at Toledo. So hopefully I'm going to be able to go out and see her soon. So
well, hopefully we can have you out here physically, and maybe when we get to do things in person. Thank you again. And thank you everybody for joining us today. I hope you enjoyed our speakers. I know I certainly did. A lot of information, and I'm really grateful for everybody that took part in today. And please let us know suggestions about things you want to see in the future. We want to keep our momentum going. We want to keep doing things for the coordinators, whatever we can do to enhance your professional development and get the information you need. So let us know what you'd like to hear.
Thank you for taking the leadership role and putting this together. Really appreciate the extra education there.
Thank you. Have a wonderful weekend, everybody. Good luck with your orientations. Talk to you soon. Bye-bye.